What's a business? Yes. Now what you're supposed to do is write some problems you're facing while speaking. What are the problems that you're facing while speaking? Write them down and you can type them in the chat box. You can type them in the chat box. I don't know, I just put now immediately 4 thumbs up have come. Good. God bless. So this is encouragement for us so that you need something more. So you need these things. Quality. Yeah. Simon Peter. Yes. Fine. So what are the things that we are going to discuss? Fine. So first, you can type in the chat box your problems. Okay, discuss your problems. Share your problems. Share your problems. We are going to start the session. Yes, I'm giving you 1 minute, maximum 2 minutes to share all your problems. Share all your problems, please. Share all your problems. So because all those things will be attended. Write down 1 or 2 or 3 problems which you're facing. Yes. Yes, very good. Get up, get up. If you have your friends, you can pass on the link to everyone. Yes, pass on the link to your friends, because this session will not come again in a span of 3 months. Okay. So these are the basic concepts. These are the essentials. These are needed for each and every candidate. So you can invite your friends. Okay, this is a free session. So you can invite as many friends as you want. Write down your problems. Write down your problems. Whatever you have, whatever you face, the difficulties, you can write down. Because once I start the session, I'll not come back. Fine. Regarding tone while speaking, I know every point but confused how to elaborate. Nervousness and false starting. Good afternoon, sir. Good afternoon. I feel nervous and lack of confidence, sir. How to avoid humming during speaking? This was the question asked today morning. I remember Srija. Pronunciation, no pronunciations. It's no plural, pronunciation of different words. And how to show sympathy, missing words while speaking, hesitation and fear, getting blank also. How to handle the anxious patient, confused sometimes and reassurance. Difficulty in converting to English. So don't convert into English, Binta. Don't convert into English. You can just straight away think in English. Finished. Start speaking. Don't think in Malayalam or don't think in some other language. To build the confidence while speaking and how to overcome nervousness. I know every point but confused how to elaborate. Regarding tone while speaking, nervousness and false starting. Good afternoon, sir. I feel nervous and lack of confidence. How to avoid humming during speaking. Yeah, fine. That's good. Okay. So now we are going to start the session. So I'm going to address all these points. The session commences. So all the writing ends there. No more writing. No more writing. When I tell, I mean it. Afterwards, anybody, okay, don't say that, sir, you did not consider my point. Because when I say, that's the end of it. I gave you time, and after that time, it's closed means it's closed. Okay, so you are not in time. So then don't put the blame on somebody else. Okay, so what you have to do is, you have to follow the timings, you have to follow the system, you have to follow the order and the decency and decorum of the platform. So when something is going on seriously, every student is seriously involved, your every word counts. Yes. So don't write anything when I'm on the lecture, while I'm speaking, while I'm telling something. I start the lecture. Don't say anything. Don't write anything. Right. It's closed. Fine. Now coming to the point, what all I'm going to give you, note them down. Yes, the session commences. The Grand Master is at command. The platform is open. Hello and welcome to Seven Sentinels. This is Grand Master class and I am Peter Simon, the trainer. Let me introduce myself to you. I'm not a nurse or a doctor, and I'm not any profession of medical professions. So what I tell you is, I'm a teacher by profession. I'm a teacher by profession. I am a teacher. I am a trainer. I'm an OET specialist. Okay, fine. I'm a certified trainer. I have a certificate of English language teaching to adults from Cambridge University. In addition to 2 training certificates from India. One is the Bachelor's in Education, which qualifies me as a teacher, and the Master's of Education, which qualifies me as a teacher trainer. I'm a teacher of teachers of English. And I have 30 years of experience, 33, sorry. So whenever I tell something, I keep in mind everything. And then, which is the best possible thing, I will tell you. So this is very important. So learn and improve. So here we start with the essentials or the fundamentals or the basics or the pivotal aspects or the central concerns of an OET speaking role playing. Be it either a doctor or a nurse, or in the matter, any other profession. So it's very serious, very important. If the foundation is shaky, then how are you going to climb the mount? I mean the mountain. You are at the first step. You're just to put your first step at the base of the mountain, and you're going to climb up to the top relentlessly and unstoppably. So how are you going to do it when the first step itself is shaky? You are going to place your feet or foot on a stone, and that stone may falter you because it may slip or skid or slide or whatever it is, and then suddenly you'll fall down there. So in the path there are many such stones. So don't put your foot or feet on the stones, which may lead you to tumble down and end at the bottom once again at any point of time. After going to the middle, if you make a faulty step, you will go down to the bottom right away. That is called failure. No pass. It's either a pass or a fail. Either you go to the top of the mountain or you remain at the bottom of the mountain. There is nothing you stay in between. There is nothing like middle, 50%, 70%, 20%. Either you go to the top, pass, or you just fail, drop down, finished, and reach the bottom within no time. So you have to take caution that this is very, very important for you. So take it very seriously. There is nothing called okay. It's just pass or fail in achieving the required scores. So be serious. Any step, faulty step, may lead you drop down to the base, bottom. And you have to start it all over again. So be careful. Be careful. Don't play the fool with yourself. Because it is the cost of almost 35,000 Indian rupees. And a lot of time you're putting in. You're investing more than money. Time is very precious. Taking out a lot of time for your studies, and if you're not seriously implementing your studies, then definitely you're not going to achieve the result. So decide now, or it will be never. Decide now, or it will be never. If you're really serious, step out of the box, out of the box. Yes, you have a lot of knowledge, you have a lot of wisdom, you have a lot of understanding. Why don't you use to the fullest? Don't limit. Don't limit. Limitations will hinder you. So go beyond the horizon. Expand to wherever, to whatever range you can stretch. Border, stretch your hands, stretch your body, expand wherever you can move. Move and try how much ever you can do. You do. Because whatever I tell with great, with the knowledge which I gained from experience of 33 years, I tell you everything. So it is a ready-made or cooked food for you. If you want to do it all by yourself, then you have to struggle, you have to find and do all these things. But I'm going to put them short within no time in front of you, and you can just get them as they are. So it's very important. It's very, very important. Any signature? Okay, okay, fine.
Disbursement spelling is correct.
Yeah, absolutely correct.
Okay.
Yes, correct. So now here it is. There goes. Now I'm going to ask you a question. And in this, what you are going to do is, yeah. Now, how many of you are extremely serious? I'll take you along. If you're extremely serious, I'm going to take you along to the other side of the river. The OET is a river. I'm going to cross you to the other border. From this side, from this shore to the other shore, I'm going to, yes, pedal you. How many of you are extremely serious? Just say yes or no. That's it. Just 30 seconds. If you're yes, I'm going to give you a lot of things. If you say no, then okay. That means you want fast food and you want easy cakes and you don't want to work hard. That's what it is going to be. Fine. Because I'm going to lot of exercises. I'm going to give you. I'm going to jump like a jack in many different platforms. Now I'm going to take you to, was that? Yes, sorry, not this. I'm going to take you to Microsoft Word. Yes, Word documents. Yeah. Very happy I am because many people say your teaching style is different. Yes, I want to, everyone is doing on the PowerPoint, I do something else. Yes. Yes, here it is. Yes, I'm going to take you some important things. These are sessions for the regular students. Today is a free session. Okay, because many people requested me literally yesterday when I closed the sessions. So they said that they had a 3 times exam. So please take us, sir. Okay, fine. I was considering of another special batch for that. Okay. I was considering because I'm just checking out my timings and all. Okay. So if chances are there, I'll let you know. Glory, please don't be disappointed if I say no. Right. Because most often I say no. Right. Now here, I'm going to give you some points. Okay. The syllabus of the OET, speaking. Yep. So this is the syllabus of the OET speaking for the present students, regular students. The syllabus, okay, or you can say OET speaking syllabus. OET speaking, the syllabus. That means what are the things which I'm going to tell you. Information gathering. Explanation of the procedure. Providing suggestions. Persuading the patients. Make a notes of all these points. Whenever I'm giving you some points, make a note, because I will read between the lines a number of times and give a lot of information. If you feel that something is very, very extraordinary or special or important, please jot down the points in your notebook, because they will not come again unless and until you go to the YouTube and visit the site and go through this session once again. Negotiation with the patients. Negotiation with the patients. Or empathizing with the patients. Wrapping up. The extraterrestrials. The role play session. And then you have the sample speaking cards. So these are the points which we are going to deal with today. First one is called information gathering. Second one is explanation of the procedure. Sorry. And third one is providing suggestions. And fourth one is persuading the patients. And the fifth one is negotiation with the patients. The next one is empathizing with the patients. Okay. Next one is wrapping up. Eighth one is the extraterrestrials. And finally, the role play session. And then the last one is the sample speaking cards. Okay, fine. These are the 10 points we are going to study in our speaking syllabus. There will be 10 sessions and only one session will come. One time only. Only one time. So don't miss the sessions at any cost. Don't miss the session at any cost. That's what I'm telling you. Fine.
What do you want to meet me? You
I asked for the gas connection. Just check it out. Follow it out. Okay. So Control Z.
even
Fine. So now here are the 10 points. Information gathering. Information gathering. That means it's called seeking information. Seeking information. I am giving you a different word. Okay. Seeking information. The title is Seeking Information. It should be classy. Seeking information. Seeking information means eliciting information. One more word. Eliciting information from the patient. Eliciting information. This is the first point. Right? Now, what do you mean by eliciting information? That means patient comes to you and he said, why you came, what are the problems, what you did, what you faced, how did you feel yesterday, and how are you feeling now? Is that okay? What range of the pain you have on the pain scale 0 to 10? All this is eliciting information. Then next, the second one is explaining procedure, explanation of procedure. Explanation of procedure. So you are going to explain how to take insulin injections, or how you provide blood transfusion. The procedure you will be explaining. So you can say explaining procedures. Explaining procedures. This is another style, another different area. I have given you the schedule of all different areas. Then providing suggestions. So after observing, I'll give you a lot of quality sentences. I'll give you a lot of quality, provided you attend the sessions. If you are not attending the session, you will not get the hang of it. Okay. Next, persuading patients. Persuading patients. Okay. Persuading patients. Do this one. It is good for you. If you do not go, you will have difficulties. So it's better. So instead of suffering, it is always better to take some measures so that you will come out of this difficult situation. So persuading. You have to be convincingly persuading patients. Convincingly persuading patients. Not just persuading. You have to convince. Convincingly persuading patients. Providing alternative suggestions. My sentences will be totally different. These sentences will go a long way. Explaining procedural patterns. eliciting relevant information. Everything I'll change. Don't think that this is ultimate. I will make a single word into double couplet and I'll make it into a triplet. Now you can see eliciting relevant information. Number one, explaining procedural patterns. Number two, providing alternative suggestions. You can use this in talking to you. I'm going to provide alternative suggestions for you. Suggestions are mine, but decisions are yours. I can only suggest you, but you can implement. It is for your own good. It is only for your benefit. If you follow these instructions, definitely within a short time, you are going to recover. And the sooner you follow these procedures, the better, the faster is your recovery process. Finished. Like a song you can sing. That's the story. Involvement. You should feel the pain for the patient. Not just saying for words. Many people, actually, they are working for salaries. If they get salaries, they can sit idly, they can watch their mobile, they can do a lot of things, but they will not take proper care of the patients. Those people, there are two types of employees. There are three types of employees. Those who will always be there, those who always be there, and those will go up and those will fall down. Three groups. People who spoil the show will be fired from their employment. That is one thing. And they will not get jobs also very easily. Because of their attitude, even in the interviews they fail. Because they cannot express their love towards the patients while interviews, they'll get rejected. Because people search for different qualities during appointments. The next one here, you have to show that feeling. Next one, explaining procedural patterns. So what is the procedure for for taking insulin injections? Okay. Or what is the procedure that you follow? Okay. While blood transfusion. Okay. You will be explaining before. Next one. Providing alternative suggestions. So now the patient has a diabetic neuropathy and is not compliant with medication and dietary regimen. So now what you can suggest is, yes, your daughter is asking, so why not you go and stay with them? And these are the things you can do. You need not come here. Instead of that, you can go to the doctor there itself. You can go to the medical clinic or health clinic. You can go there and you can register your name there. I'm going to give you a referral letter. You go there, give this letter, and they will take care of everything. And whenever you have a problem, you go and meet the doctor. And he will do the needful for you. Because you'll want some special guidance in the time of problem, then definitely when you approach them, they will do everything possible to support you. Because rather than coming here, all the way from Centerville to here, you can just go to Centerville itself. So you can go to that particular doctor, because the doctor here or the doctor there, okay, we are going to provide all the details of your case history to them. And regarding all your, problems and what are the actions taken on you, all the history will give them, and I give a referral letter to you, and you can take this and submit to that doctor, and he will take care of everything. So alternative suggestions. So because Peter Dunbar came to the hospital and he is telling, my daughter wants to take me to her home because she wants to take care of me. Okay, I am not able to convince her. She's forcing me. I don't know. I have to go now. I don't have any other option. She's not readily accepting. I say I don't want to come there, but she's not. She's somehow taking. Now what to do, doctor? So this is the option for me. I can stay here. I don't want to go there. What to do, doctor? So you are giving alternative suggestions to him. So how are you going to convince? So next one, convincingly persuade. Yes, Mr. Dunbar. what your doctor is telling is not just out of love, but because of the affection she has towards you. Seeing your plight, seeing your condition, seeing your status, and knowing that you are not compliant with your medication and dietary regimen, and because you are helpless, nobody is there to cook for you, and nobody is there to help you in any way. So she takes that serious measure, those serious measures, and she is inviting, why don't you go there? Because she will take care of everything. Now you'll be under observation. Every time she cannot come to you here. So there, she'll be always monitoring you. And just at a call or a nod, she'll be next to you and she'll be ready to support you. So it is wise of you if you accept her suggestion, okay, and you go there and stay there until you are recovered. Because loneliness is another problem. Because you are here lonely, you may be thinking and you are getting upset and you are getting worried. Because of that, you're not remembering anything. So at least if you go there, you'll have some people around, you'll be happy, you'll have a nice time, and there you'll have timely meals and a proper diet and regular medication. She will mind all these things and she will give you on time. And you will not have any problems such as how you are facing now. That's it. Shoot the ball into the basket. And that's the game of basketball. That's it. Straight into the basket. From wherever you are, ball should fall into the basket. That's your victory. Every ball. You will not try to hit the board somewhere. You will see that the ball will fall into the basket. That's it. Ultimately, the end of the day, at the end of the day, the result is more important. How much you practiced is not important. What is the score you got? Is it 290 or 340 or 390? What's my score? Where I stand at the end of the day, on the examination day, result day, what's my score? There is your marker. So do anything for that. Let it not be 290. Let it not be 340. Let it be 390. That's the point. That's the target. I want to pass. I want to pass. I want to pass. That is not. I want to learn as much as I can. If I learn as much as I can, I will do as wonderfully as possible. Then definitely my score will be as excellent as possible. You say, I want to pass. I want to pass. Do not hope. Do not hope. Let not hope drive your destination. Let your actions drive to your destination. Not just hope and desire will lead you nowhere. Hopes and desires will lead you nowhere. All your actions and efforts will transform your position from the lowliest to the mightiest position. So do that. Next one is convincingly persuading patients. So don't give like orders. Don't give, see, I'm telling you, you go to your doctor. What is this? You're ordering or you're commanding? Go to your doctor. Commanding, ordering. Dear gentlemen, somebody is bothered about you. Your daughter, she's very much bothered about. She came all the way from Newtown and she wants to take you to there. And she wants you to be with her all the time so that she can spend most of the time with you. Take care of all the things to the best she can. So why don't you oblige? Say yes to her, be with her, and become better. These are my suggestions. And you are wise enough. Definitely you'll understand what I'm telling you. And I believe readily you will agree. Because ultimately, at the end of the day, it is your health that matters to you, your daughter, and also to me. I want to see you happy. So this is called negotiation with the patients, making them see those things which they cannot see. Yes. Yes. And a big yes. Next one, empathizing. Okay. Displaying empathy. And concern. Empathy and concern. Displaying empathy and concern. Okay, and display empathy and concern. I am concerned about you. I love you. I like you. Your health is more important for me. You are very precious for us. Okay, if you're happy, then I'll be very happy. If you come out of this problem, it's my pleasure to make you come out of this problem. So that he should feel that. Okay. So displaying empathy and concern. Okay. Right. Wrapping up measures. So final wrapping up measures, concluding, ultimate wrapping up measures. Ultimately, finally, you're going to conclude the show. Yes, by the way, after all the discussion I had with you, I can understand your problems and I have discussed many important things with you. I have given you alternate suggestions. I have told you the importance of medications and I have trained you and counseled you regarding your diet. And now I believe that I have clarified everything to you. If there are still any more things that you want to discuss anytime, you can just call me and I'm ready to help you. It was pleasure talking to you. And I believe that this discussion has helped you, okay, in increasing your confidence to battle the situation, fight and overcome this problem. Okay, overcome this problem. Come out of this problem. Okay. The sooner the better. For your speedy recovery. I pray for your speedy recovery. In case you follow this and implement with all your body, mind, and heart, your recovery will be sooner. Okay. For speedy recovery, you have to follow these measures. Thank you very much for patiently listening to me and accepting my suggestions. Have a nice day. That's it. So that is ultimate wrapping up measures. I'll give you a lot of points. The next one, the extraterrestrials. What are these extraterrestrials? Extraterrestrials means these are not internal, but these are external. That means your feelings, your eye contact, your body language, your expressions, your hand movements, your gestures, your nodding of the head, slowly nodding the head. That means, okay. Speedily nodding. I agree. So everything speak a lot. Everything speak a lot. So these are some points. The extraterrestrials. Okay. The promising beneficial extraterrestrials. Promising, that means they are going to give you a lot of, they will bless you. Beneficial means advantages are there. And extraterrestrials means other than speaking, there are many other things. For example, when you're talking, if I sit like this and talk, I'm doing something on my mobile phone, and I talk, what you have to do is you have to, what is this man doing? That means his mind is not here. His mind is divided between two things. That means he's not doing 100%. So these are the extraterrestrials. So this is the position. Shoulder to shoulder. Face to face. Don't look this side, face to face. Eye to eye. Okay. Body to body. Straight. Okay. Knees also straight. And your feet also straight. This is called 100% posture. When you're attending somebody, people will respect you. People will appreciate you. This is called top to bottom attention towards the other person with great respect and adoration. Little bit of respect is not there. Suddenly phone call comes, you'll go there. That means you lost the track. So you move this side. See, everything this side, but you move this side and take your phone. Your eyes contact is here. Your eye contact is not towards the patient. So eye contact, face to face, straight face to face. Not this side, little this side also no. Straight face to face. Look into eyes of the patient. Okay, you'll get some contact, you'll get some bond, some relationship, some loving and affectionate relationship. Okay, fine. The next. So, beneficial. These have a lot of advantage. When you see, when you talk. So, there are three positions. Now, sitting postures. You sit like this. That means I am the boss. Sit like this. Means I am a leader. Bend like this. That means I am a subordinate. So now, are you a boss or a leader or a subordinate? You decide your fate. If you are going to be a boss like this, that means you are going to lose your reputation in the eyes of the patient. He will say, okay, this doctor has some demand or government or pride or something. Okay. If you are like a leader, he'll be ready to listen to you. Okay, but you will be bending like that. Always be ready to bend towards the patient. Bend towards your patient. Be ready. You are a subordinate of the patient. You are employed for him. You are his assistant. Even I myself, I am your assistant here. I am not a leader. I am not a boss. I am your assistant. So that's why many times when I am in serious lectures, automatically I fall down. So that shows your interest. Whenever you go deeper, your head falls down, your body bends forward because you are going deeper into the topic. And when you are relaxed, see, I come back. So that is how it is every time. Show, bend towards the patient, shows that you are interested in the patient. You like him, you love him, you respect your job, you respect your patient. It's very important to you. This is how. Show the feelings. Speaking is full of feelings, emotional feelings. Emotional feelings, positive emotional vibes. For example, whenever I come, many students say, sir, your lecture is different because I contact my relationship with my students. I just zip every mouth because I will not allow anybody to speak. They will not even write anything. They'll just be spellbound, astounded, and just be silent spectators. I'll use that magnetism. I use that electrification. I'll make you stupefied. I'll say, freeze. That is how it is going to be whenever you have to attend my lessons. Otherwise, I'm not a teacher at all. A teacher, a good teacher and an excellent teacher. You might have seen how differently it is displayed in men. A good teacher teaches. An excellent teacher motivates. A better teacher motivates. An excellent teacher inspires. That's what it is. When an excellent teacher teaches, there will be goosebumps all over your body. That is how it has to be. So here what I'm telling you, like that, if you're an excellent nurse, your patient should cry at your love. Oh, this nurse, he likes me, he loves me. No problem, my child. No problem, my sister. No, my husband, my daughter. No need any one of you. This nurse is enough. That is enough for me. I don't want anybody of you. You get lost. Like that power you have to get. Can you instill in the patient that feeling, that pride, that power in him regarding you? Then you are the real nurse. Otherwise, you are a nurse for the name's sake, not a nurse in reality. Remember that. You're not doing justice to your profession. That's what it is. So, that's what it is. Any profession by that way. Justice to your profession is very, very important. When you take some responsibility, you have to achieve the targets. That's it. So that is called promising beneficial extraterrestrials. Now these people, when they go out, when they walk out of the hospital, they'll say, "Thank you, nurse." They come and hug you, and tears will fall from their eyes, and they say, they'll even give a smack on your cheeks, especially the older generation. They'll give you a kiss on your cheeks and they say, "My dear child, God bless you. God bless you." That's it. If not done, do it from today onwards. Make it a reality in your life. So no need any preparation in the OET exam. You just to go and blast the OET. Because every day you are living with the same scenario, and when you go to the OET exam, you need not prepare. Because every day is real practice for you. Oh, this is artificial practice. Are you doing it in the real life? As a nurse, are you doing all these things? Then no need of all these things. Oh, no need of Mr. Peter, no need of lecture, no need of preparation, no need of anything. Directly go and sit in the exam. You'll get 450 above in the OET speaking. Feelings. Did your heart feel for the patient? As if she is your child? They are helpless. They're totally dependent on you. These are the blessing angels, extraterrestrials, bent towards, eye contact, face to face, body to body, shoulder to shoulder, complete body, knees to knees, everything, 100% undivided attention towards the patient. These are called the extraterrestrials. Means they will be wandering around. Terrestrials. Okay? We think that we don't need, we feel that they are extra, but they are very, very, very important to make a 200% or 300% magnitude of your impact. The impact you have on your speech, when you're speaking, normally it is 100%. But when you use these extraterrestrials, it will be multiplied to 200% and 300%, because you will reach out to the heart. Normally, whatever you are speaking to the patient, okay, take this medicine 3 times. Take this medicine 3 times. 1 tablet in the morning, 1 tablet in the afternoon, 1 tablet. I would like to tell you some important information, please. These are the tablets that you need to take on a regular basis. 1 in the morning, 1 in the afternoon, and 1 in the evening. Please do not forget. What is the style of expression you had? If it is the first, then you are lost forever. If it is the second, you are the best person in the world, and your score will be the best. Both are different phases. This is normal phase and this is extraordinary phase. Do you want to be a simpleton or do you want to be an extraordinary? Do you want to just pass or do you want to excel? It is your decision. Suggestions are mine. Decision is yours. Take it or leave it. I have no problem because I did my responsibility 100%. I know that, so I don't bother about anything else. And the next one is the role play session. Role play will be always hyphenated. The role play session, actually before this role play session, there will be two more things. The warm-up session. The warm-up session and the role play session. See, I did not teach anything regarding nurse. It's for everyone. Some doctors came, they dropped out in between. So they don't have patience. I told it is for everyone. When I told nursing specific, they went. I was just testing them. They don't know. Okay. So no problem. The role play session and the sample speaking cards. And next one is, the last one is the hands-on speaking practice. I have given you a number of groups. Go there, practice there. And once in a blue moon, come to me. When you feel very confident, come to me. Directly, if you come to me, I'll blast you into pieces. Because I'll tell you, these are your mistakes, these are your 100 mistakes are there. Because my style of presentation is totally different. I will record your speech. I'll get it typed. And I'll point all your mistakes. And I'll correct all your mistakes. And I'll tell you all the suggestions. My speaking style is different. It's not just like blah, blah, blah. I'll record your audio first of all. And I'll get it typed. Like how you are writing. Everything is on the paper. Your speaking also will come, everything on the paper. Then I'll. One second. Then everything. Okay. Everything I'll present in the paper. Got to put the AC on. Okay. So now here, the warm-up session, the role play session, the speaking cards, you know all this. The hands-on speaking practice is, I'm giving you some sessions. I have given you some 10 rooms or 8 rooms, 10 rooms, I suppose. The open students and the regular students also separate 10 rooms where they get extra importance. So first the regular students will get importance, and when they are free time, then they will take the open students. Okay, fine. There is nothing called free meals. Nobody is getting anything free. I am paying for it. I am paying for it. The Grand Master is paying for it. The 7 Sentinels is paying for it. The Classical Corrections is paying for your practice. So don't play the fool there. Okay. There is nothing called free meal. Even if there is in Amritsar, they will give some, sometimes they will give free meals on the roads. They will present some as a gift, okay, token of love to the fellow beings. They'll come and share meals. I don't remember what is the word they use. So they'll come with a big gallons of water, buttermilk and other things, and they'll give free. So everyone say freely, free, free, free. No, no, no. It's never free meals. Somebody is paying for it. Somebody is paying for it. Remember that. There is nothing called free meals in the world. Somebody is paying for it. Remember, and don't waste it. Okay. So there you go and practice every day. Every room has 2 cards. Okay. So you can practice 2 cards. And this is my gift to the people. Because the world has given me a lot of things. So I'm giving freely from my side. Okay. So whenever you have option, you go to the rooms, practice. At least your moms can say blah, 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 something. Your mouth can have that frequency, that fluency will come, that confidence you can gain, all those things. Then one fine day, you can come to me, then I can take, not always, it's not a demand, it's a request only. Okay? It's a request only. So whenever I have time, maybe I'll take 1 or 2 speaking sessions, and those who are deserving only, not to everyone. Okay? They request me, then I'll study them and I'll get them typed, then I am going to explain them. But only for all the regular students, it's free. Okay? Those who have registered with us. Right. Next one. Hands-on experience, that is speaking practice. Then real testing scenario. Real testing scenario. The last one. The realistic testing scenario. Yes. Now, when you come to Mr. Peter, or you go to the interlocutor, when you go to the examiner. So, for example, I'm also behaving like an interlocutor or presenting like an interlocutor for you. But after that, I will be examining you. I'll be evaluating you. I'll be interlocutor plus examiner plus evaluator plus the feedback provider for you, all in all. So, then that time you will know what it is. So, these are the mighty 13. The mighty 13. 13 is my favorite number. The mighty 13. Yes. So all these points are very, very important. I have given you a lot of sentences. I have given you a lot of explanation. I have given many different things. Yes, langar. Langar is the word there. Fine. Okay, now what you have to do is your feedback, please. Your feedback, please. I'm giving you 2 minutes for your feedback. Okay. Yes, your feedback, please. I'm giving you 2 minutes. After that, I'll give you some more points. Yeah, there were many students yesterday. I filled up the sessions, but there were some students who were asking, please, sir, we don't have time. So take admission for us. Some people were asking. So I opened up 4 places. I can give accommodation for 4 students. Okay. This is not evening time. This is morning time. Those who are ready to attend in the morning time, you can join. Okay. So that too, based on your request, I'll see whether your request is genuine or not. And if you are working, maybe I will not give you the place, please. If you're working, I'll not give you the place. But if it is for 3 months, I'll give the working place people. Otherwise, if it is non-working people, only for 1 month. So you can contact me personally. Okay. So that is what I'm very serious, and I will not make any changes. So those who want to attend the sessions in the morning time, I am opening up 4 places. And here is my WhatsApp number. So you can contact me. And only when I am free, I'll attend your call, because most of the time today I have full sessions. So when I'm free out of sessions, I'll discuss if you want. Only if you have a noble idea of clearing out OET, no, excelling in OET, excellent. I want to score 350 and above, sir. Don't say I want to pass OET. Then I will not give you place. So WhatsApp.me. Yes. Yes, here is my WhatsApp link. So this is WhatsApp link. WhatsApp link. So you can write your comments. Okay, 1 more minute left. So you can write your comments. This may be boosting up other people so that they can attend the sessions whenever I give open sessions. Regarding writing, speaking, and listening. Sorry, regarding writing, reading, and listening, open sessions are closed. Okay. So open sessions are closed. They are only for the regular students. And speaking, we have open sessions. So I'm giving you. So we have open sessions for speaking, one on Friday. So you can attend the speaking session on Friday, right? Okay, fine. So the regular students, be ready for the session, a writing session. I'm going to start at what time I told. Let me check. They will be coming. My assistant will be providing you the session timings. Okay. So it is 4 p.m. I think I told. 4 p.m. So next, now coming to the point. Yes, let me check it out. Sri Lata. One second, hold on. Yeah, Sri Lata. Hello, Sri Lata.
Good morning.
Yes, Sri Lata. Yeah, can you share your experience about today's session, please?
Yeah, sir, I really take this privilege to talk about this session of today. It was such a mind-blowing session where I could understand. As said, I'm very new to all these sessions. This is my first session again, but it was such a mind-blowing thing which I got through it, each and every point which you have discussed. Thank you so much, sir, for
Right.
accepting.
Thank you. So the session is here. I have sent the link. Okay, I have sent the link. The writing session at 4 p.m.
Sure,
Okay,
sir.
the writing session at 4 p.m. Right. So regular students can attend. Okay, non-regular students you can watch on the YouTube if you want. Okay, because I'll be discussing lot of things with the regular students. I don't want any distraction like how I had yesterday or okay, quite some time back. There was one doctor, he was telling, sir, you are taking too much time, sir. We don't have time. So I told, get lost. Why are you here? I don't mind. That is your problem. You have to solve it. I have all the time in the world for my children. If you are just coming as a visitor, I don't need you and you don't need me. So why are you here? It's a wrong relationship. So you're not supposed to be on my platform if you don't have time. Okay, go and have some fast food somewhere. Okay, ours is a 5-star, no 7-star hotel. Okay, restaurant. We have a lot of decency and decorum. We cannot rush. Okay, we do things very affectionately and professionally. So we don't mind. So I don't want any disturbance. That's the reason why I avoid. And I will not, even if they come also, I will not entertain. And one more thing I'm telling you, all the regular students come with your proper names. Otherwise, I will not let you in. The room will be locked. This is only registered student specific. Those who have registered. Okay. Those who have paid the fee and joined, for them only. The gates will be open. I will enter you in. The room will be locked. So you cannot even come. Okay. So please come with your names. Like yesterday, somebody came with their Galaxy or some other names. Okay. Or another name or pet name or somebody. So then I will not allow you in because I don't know who you are. I will think you are one of many. So when you are joining the Zoom, come with your name and I will open the door for you because it will be waiting list. You will be waiting in the room. You will be knocking, but I will not open. I will not open. So only for regular students because I don't want any disturbance. I don't want to spoil my mind with unnecessary points or topics or comments. So just to avoid such things only I do like that one. Otherwise, these 2 or 3 people only make me to take harsh decisions. What to do? I want to be open and friendly. Even if they want to attend one session, I can. But because of some people, I decided strongly that I will not give. Okay, right? Because until and unless you know how to respect the other person and deal with them properly, you are not worthy of staying there. So that is what the point is. And I already know, right? So 30 years of experience, what to do. So now, regular students. So you can say, how many of you are interested to attend the session? Yes, regular students. So interested to attend the session. You can send me personal message. Only regular students, you can send me personal. Okay. So send me personal message so that I will give you the link. Okay. And only very few students who are available, those only I'll give. Others, let them see on the YouTube or whatever they want. It's not our problem. Okay. So let me see now. Writing part 3. Writing part 3. Peter Dunbar. These are the main things, and these I will not share with anybody because this is my hard work. Okay. Peter Dunbar. This is the body of the letter. So how many of you are interested? So yes or no? Those who are interested, regular students, you can say yes. Okay. Manpreet, send a message to my personal WhatsApp. You will be sent a link. Okay. And come with your name, Manpreet Kaur. Don't come with any other name. Kavita, come with your 2 names. Kavita, second name also. And Prasanti, yeah, very good. Prasanti, Adari Prasanti. Okay, fine. Right. So come with your names, 2 names. Prabjit Kaur, very good. Say, come with the same name. Upula Srilata, come with the same name. Then I'll open you. Even if you don't, okay. Right. I'll send you the link. Yeah. So now, finally, okay, we had some comments. Right. Finally, yes. Everyone in the meeting. So, what did you learn today? So you have to write 3 points. What did you learn? Number 1, what did you learn today? Number 1, about yourself. Number 1. Number 2, about OET speaking. Number 2, about role play session. Or about OET speaking, and then about what you can say, achieving success. So about yourself means you as a person. About OET speaking means to clear OET. About achieving success means to excel in OET. So these 3 things. So you can write 3 sentences. Write 3 sentences. Yes, Anne Matthew. You wanted to say something? Yeah, share your experience. Anne Bilgi Matthew. Hello, Anne. Hello, Anne. Hello, Anne. Where are you talking from? Where are you calling from?
I'm from Trivella. Kerala.
You are the one who called me yesterday, right?
Yes, yes, yes.
Okay, I talked with your husband, right?
Yes, yes, yes.
Then there
You
you
talk
wrote
with me.
Annie, and here you are writing.
Annie.
So that's why I was little confused. Okay, okay. Can you share your
Okay.
experience, Anne?
Yeah, you know, this is the first time I found a teacher like this. You are clearing our doubts and you are explaining with us nice examples. We can understand very well. That's why I influenced by you, and I told my husband even I want to. I want to start with the.
Yeah, because of you only, I
Sir,
am opening
I
4
want to
places.
begin a
Okay?
class.
Because of you only, I am opening
Yeah,
4
thank you, sir.
places. Actually, if you have not contacted me,
Thank
I
you.
would not have given 4 places. That was closed. So you requested, and your
Thank you.
husband was literally asking me, sir, please do something for her. She really wants to do. She's telling me to do something for you. Okay, so like that was. So he requested me. So that's the reason why I accepted you. Okay, fine. No problem. No problem. It's okay. So
Thank you,
did
sir.
you get what you wanted?
Sure. I know how to take the matter. Always when we are in front of somebody, I feel a little nervous, and due to that, I am getting the everything. I cannot tell anything, and I am getting blank. So now I can. I got some confidence to face the exam.
Okay, fine. Very good. Very good. Next, Jinu George.
Okay.
Is it Jinu Ajit, Jinu George the same? Hello, Jinu.
Yes, sir.
Jinu
Good
from
afternoon.
Kuwait, right? Currently in
Yes.
India.
Yes.
Okay. I think I'm shouting too much, no?
Today was the first time I was attending your class, and so I didn't attend the first session. In between, only I could join half of the class.
Okay. Did you learn anything new?
Yes. I
Or
learned.
did you think why this mad fellow is shouting like this?
No, everybody has some different style. No, this is your style, so it is very effective for us. So you are explaining too much, so it is very effective, I believe.
So I'm explaining too much. Do you suggest me to reduce a little?
No, I mean, because I have learned, because for the newcomers, it is good for them to explain too much, no? No, because I finished the class and the exams.
No, this is only one time it will be there, no, not always, right?
Yeah, okay.
Then afterwards you'll go into the role play, then it will be different.
Okay.
Okay, because this is the first day of speaking. So
Okay.
I have to tell about the basics now.
Okay, sir.
Right, I have to tell about the basics, definitely.
Okay.
And many of them are new for you also, I think. Correct?
Yes.
Huh?
Yes.
Fine. So examples you can use when I'm giving an explanation with examples. Those examples you can use in the real speaking yourself, correct?
Yes, sir.
You can say the same word. See why I am giving so much explanation, because you can parrot my sentences in your role play.
Yes. As you
If you are
said before,
listening to me,
when
my style, my attitude, my presentation, my fluency, my accuracy, my vocabulary, my grammar, at least some things will be going into your brain, right?
Sure.
And you can imitate the same style. So the more I speak, the better for you, correct?
Yes, sir.
Ready-made
As
food.
you said before, when we are in the real health scenario, like when we are treating the patient, if we are talking to them on the real situation, it is more benefit, I feel. When when we communicate with the patient, no need to study and more about the speaking or anything. I feel like that whenever I get time.
What you have to do is every day you should think that you are in a real situation and you really participate in the real situation. Then automatically it is natural, no?
Yes. As you said, it is correct, because I was practicing that one when I am with the patient. I used to talk. The communication, I feel it is more important for the patients because they want to
Real
know
life
more about it.
experience.
Yes.
This is artificial. Learning here is artificial, but real practice is more important. So what you have to do is take somebody, ask them to pretend like a patient, and as if real patient, he has to do all the drama, and then you have to talk to him. Then it will be the fun, it will be real experience. Okay.
Yeah, this is not effective not only in our this for the exam. It should be effective for our real when we are
Yes,
working with
long
the
run.
patients. It should be
Yes, of course, you are absolutely right. You are absolutely right. You are the one with the 3 children, right?
Yes, yes.
Okay. Now I remember. Starting, I don't remember many things. Okay, slowly, I'll get to know. Okay, fine. Okay, right. So, were you happy with the session, or you wanted any
Yes, sir.
changes in this?
No, because I am going to face this in 10 days my exam. No, that's why I
You
felt
are
it is.
going. Yes, those who are going for the exam on the 23rd, they are going to face me every day, and I am more powerful than the interlocutor there. Okay.
Okay, sir.
I'll scare you to death also sometimes in the speaking sessions. You'll feel
Okay.
that more than a real patient, then automatically with that you'll gain confidence and
Okay.
you'll do perfectly well in the exams. Okay, don't worry.
Okay, so thank you.
Okay, fine. Write some points which you have learned today, as I have told you. And next is Kavita Viswanath.
Yes, Father. Good afternoon.
Hello, Kavita. How are you?
I'm good, Father.
Yeah, tell me. I don't know why you say father, but every time you say, I feel like really, oh, this is my child, like that. And you remind me of every student like a child. Yeah, of course, I really feel that one. But when you call me, that really is not something depth. Okay, yeah, tell me, share with me your experience. Share with your friends your experience, please.
Yes, Father. This is really a nice class, a nice experience. You clear all our doubts from the starting, and it's really a nice explanation, Father. For each and every point, it's very clear. Even who don't know English, also they can understand easily.
Okay, very good. Okay, fine. Next, Manpreet Kaur. Manpreet Kaur, nursing college professor. Come on.
Yes, sir. Good afternoon, sir.
Good afternoon. You don't want speaking, no? You want only writing, right? I remember.
Yes, no, sir. I won't teach and everything because I'm too much nervous about my exam. I earlier told to you. Today, speaking session is good. I learn more things about how to reassurance and each and every point I will understand.
Okay.
Yes, sir.
So, do you have any suggestions for our friends?
Yes. Please learn in the please learn every topic in the detail. After that, you can crack your exam in the first attempt and do hard work at least in a day. Do one reading, one listening, and writing also, and do more 5 to 6 speaking in a day if you want to crack your exam in the first attempt. And so do hard work.
So, I have placed these 13 points in the chat box, and I'm going to place these 13 things again in the WhatsApp group. Okay, I'm going to place it in the WhatsApp group. Commandos. So all of you must be in the commandos group. Okay, so because all the things you will get there. So Manpreet, I want you to design these 13 points in your style. Okay, is that clear?
Okay, sir.
And you have to post it to me or in any one of your groups. In classical correction group, you post. From there, I'll post it into the OET commandos. Okay,
Okay,
OET
sir.
commandos, I'll post there. So you have to design this one into a beautiful design, attractive one. Okay, because girls are
Okay,
better
sir.
at displaying colors and designs. Okay, so fine,
Okay,
you can
sir.
do that with flowers, designs, whatever you have done. I liked it, so that's why. And the men are very weak in that area, so I want you to do that one. And then
Okay, sir.
fine, that's good. So next we have yeah, Prabjeet Kaur. Hello, Prabjeet.
Hello, sir.
How are you?
Sir, I'm good. How are you?
When did you jump into the ocean?
Yes, sir.
When did you jump into the session? I mean,
Sir, in the starting.
in the starting only you jumped. Okay, you're ready for that. Okay,
Yes,
okay,
sir.
fine. Okay, fine. Yeah, share your experience, please.
Sir, the session was really good. I got one new word, elicitor.
Wow. Okay.
Sir, yes. The main focus is on vocabulary right now because I think that's why I just did not cross the line. So I'll focus on that. So overall,
Right.
sir, the session was really good.
Okay, fine. And next, Prasanti.
Hi, sir.
Hello, Prasanti. What was your experience? Can you share?
I joined in the middle, sir. Presently, I'm in the duty.
Yeah.
So I listened the syllabus which you have said, the 10 points. I listened that one. From that, I learned like how to gather the information. I have learned something, sir, but I need to watch again.
Okay. Fine. That's good. You're on duty now?
Yes, sir.
Oh, I'm sorry. Okay, fine. This is online. When you are on duty, better don't talk. Okay, please. You can just silently listen or watch, but don't talk when you are online. Okay.
Yeah, I hear no
Yeah,
one, sir. That's why
because
I'm
nobody
sitting
is
in
there
one
here,
place.
but somebody may watch from somewhere and they'll say, see, on duty, she's watching like that. Like, why to
Ah,
unnecessarily create headache, no? Because this is
okay.
online, no? Everyone can watch the video on YouTube. Okay. So avoid
Okay,
that.
sir.
No problem. I don't know that you are on duty. So just, okay, fine. No problem. Next one. Srilata. Hello, Srilata. You're the last one.
So I
Yeah, you
already
are the
spoke
last one.
before. Yeah.
You already spoke. Okay, fine.
Yeah.
So that's the end of the session. That's fine. Okay, have a great day. We have yet another fruitful session shortly. So be ready for that one. Have a nice day. Bye-bye. Hello, Anu Anthony. Who is this Anu Anthony? Just now you dropped in, I feel. Hello? You just finished the session. I'm sorry for that. Hello, Anu.
Hello, sir.
Yeah. What's your full name?
Anu Anthony, sir.
Anu Anthony. Where are you from?
I am from Kottayam.
In India presently?
Yes, India.
Okay, okay. We just finished the session. Just finished.
Okay, sir.
It started at around 1 o'clock. And we just finished at 2:30. Okay. Sorry again. The next link will be there. That time you can join. Okay.
Okay, sir. Thank you, sir.
Okay. I have sent the WhatsApp message here. You can send me personally. Okay.
Okay, sir.
So I don't think you can get that one. Now I'll give you the link for. Yeah. So you can just click on this link. I'm sending WhatsApp link. You can just click on this link and you can connect to my WhatsApp.
Okay, okay, sir. Thank you.
Okay,
Thank you, sir.
fine. Okay. Bye bye, everyone.